Have you ever gotten the sense that when you talk about natural birth with your family, friends, or even your medical provider, that they just don't get why it's important to you? Maybe you've even had a conversation with your provider and they told you that they'd prefer you didn't consider a natural birth, or told you that it's not a good idea or that it's not possible. My name is Rebecca, and this is a topic that's really important to me. When I got pregnant, I thought the fact that I worked in a hospital and had a relationship with the OBs would make my path to a natural birth easier. The truth was, even though I had access to expert medical advice, my journey to a natural birth was not easy. And it wasn't because these medical experts weren't willing to help.
I came with a different sort of set of information than the average mom. I don't work formally in OB. I am a physical therapist. I do see patients on the labor and delivery floor. I see outpatients that have recently had babies, but my field of expertise is actually pediatrics. But I have a lot of medical education, and my provider knew that. And I don't know if that gave me a leg up in getting the birth that I so desired, but I did have a fabulous natural birth in a hospital. And I want to share with you what I think the secrets are to making that happen. It isn't really a big mystery what providers are looking for in their patients to help the natural birth process. I want people to understand what it is and what it's not. I want people to be empowered to at least leave the options open of having a natural birth. And I really want you to understand what is standing in your way to a natural birth in terms of talking to your medical provider. So, what is a natural birth? What is it? What constitutes a natural birth? So, a natural birth is a birth that happens with limited or no medical intervention. It's as close to the natural process as possible. No pain medication is used during labor, and it's the way that babies have been born for thousands of years. It's as close to the natural process as possible. Natural births are the way births happened for thousands of years before birth came to hospitals. Birth in hospitals has really only been the last 70 or so years of human history, so it's a new phenomenon that babies are born in hospitals. It was about the 1940s that birth became more popular in hospitals. So does that mean that all natural births happen in hospitals? When most people think of natural birth, they think of them happening at home. And the answer is both. Natural birth can happen in a hospital, in a birth center, or at home. You don't have to have your baby on your living room floor for it to be a natural birth. It is absolutely possible to have a natural birth in a hospital, and the focus of this talk is going to be how to talk with your medical provider about having a natural birth, especially if you're going to be in a hospital, because that comes with different set of rules and regulations as far as the openness of the provider to provide a natural birth experience. So why is a natural birth important? Why is it that so many women strive for this, yet so few people actually achieve this? A natural birth is important because it represents the way that we are meant to give birth. It's what our bodies were created to do, and it's doing it in the very most natural way possible without anyone intervening in what naturally would occur. So now the most common question that I get after saying that limited or no medical intervention is the goal of a natural birth is, but what about safety? What about maternal and infant mortality? Which is a very, very good point. Certainly, our infant mortality and maternal mortality have improved since 100 years ago. But the scary thing is that our infant mortality compared to the rest of the world here in the US is not very impressive. So this list on this slide that you're looking at is all of the countries ranked for infant mortality in 2014. So number one, which you can't see on this slide, is Afghanistan, which has the highest infant mortality rate. It's about 100 or so babies, I believe, per 1,000 that die within the first year of life. And then it goes all the way down to number 224, which you also can't see on this screen capture. And that represents Monaco with the very lowest infant mortality. They lose about one baby out of 1,000 in the first year of life. You can see that the United States is 169 on this list with 6.17 deaths per 1,000 births. And infant mortality is defined as death up to 1 year of age, which is important to understand too, especially when looking at some of the countries with higher rates. So if we were to flip this chart upside down and rank them from the very best to the very worst, the United States would be number 55. Isn't that kind of shocking to think about? The United States, a pretty rich country compared to most of the world, a powerful country, a country with advanced medical care, has an infant mortality of 55 out of 224. That's scary. If you look below the United States, Serbia, Lithuania, Croatia, Bosnia, all of those have better rates than us. Why is that? What's going on with how our babies are brought into this world that is causing that to happen? So we know that there's a lot of things that contribute to this. The frustrating thing about it is we don't know which factors are the most important. And the reason we don't know what contributes that's most important is because we're not allowed to study it. We're not allowed to take two moms and give them two different drugs just to see what will happen. It's not ethical for good reason, but unfortunately, a lot of the things we do around birth and pregnancy and the immediate postpartum period, we don't know what the effects of those interventions are until after they've already happened. And we've had a whole generation of people that have been exposed to whatever drug or whatever procedure to study them. So that's very scary. And the classic example of this, where birth is considered, is thalidomide. Thalidomide was used to treat morning sickness in pregnant women in the late 1950s and early 1960s. And while it might have helped with the morning sickness, many babies were born with deformed limbs or missing limbs. And 40 to 50% of babies exposed to this drug did not survive. That's pretty scary, because we didn't know it until after those babies had lost their lives, what this drug was doing, because we weren't allowed to study it. So think about thalidomide. That's an extreme example. It didn't take very long to figure out that thalidomide was causing a problem. But unfortunately, a lot of babies were born with limbs that were missing or deformed or died. But it wasn't out there for very long. We were able to stop its use before an entire generation was born. But think about some of the things we do in birth now that aren't as significant as the thalidomide as far as their side effects, but maybe causing health problems that we're not going to be able to study until we have a whole generation of kids that have had whatever intervention or whatever drug. So the things I'm thinking about when I'm thinking about birth now and what is not natural about birth, about how so many people have babies, are things like the epidural. Epidurals consist of narcotics. Narcotics are a class of drug that also heroin and cocaine fit under. Pitocin. Pitocin is a synthetic hormone of oxytocin, something your body naturally makes, but it's not given in a dose that is at all related to what the woman's body would naturally make. It's given until there's an effect. And how much is too much and what the side effects of this really aren't well understood. And painkillers, fentanyl and other drugs that are used for pain control in labor are given, and sometimes the person that's receiving the drug will have side effects or things that are unpleasant that the drug caused. But what is it doing to a 7-pound baby who's being exposed to a dose that's intended for a 140-pound person? So when looking at all of this, the best and biggest reason to have a natural birth is that we don't actually know what all the side effects of these OB interventions are. We haven't been able to study them in detail, and we're probably going to find out that they are doing some harm. And is that really a risk that you're willing to take? So now you're thinking, wow, that's scary. Why would anyone elect not to have a natural birth? Why is natural birth not something that everyone chooses? And I would agree with you. But there are reasons. And the biggest reasons why people choose not to have a natural birth are a lack of support from the doctor or hospital, a fear of pain. Now that we have such wonderful pain control methods to use in labor, the general consensus of society is that childbirth should just not be painful, or that if it does become painful, there's something you can do about it. A lack of education on the part of patients, families, even doctors to some extent, just as they interface with their patients. Social stigma, by that I mean I have heard moms be told who are interested in natural birth, oh, don't be a martyr. Don't be a martyr. That for some reason choosing a natural birth is, being a martyr for your child. And I also frequently hear, well, epidurals are not really a big deal. My mom had an epidural and I'm fine. Sort of brushing off the fact that there could ever potentially be a side effect to having a certain procedure. So in the interest of time, and because this is to focus on specifically communicating with your physician, we're going to focus on the first one for this talk, a lack of support from the doctor or hospital. So why would a doctor not support natural birth? And there's a couple of reasons. One is they're desensitized to the term natural birth. They are so used to someone walking into their office, sitting down and saying, I want a natural birth. And the physician, of course, then says, great, that's wonderful. What's your birth plan? What have you done to prepare? And the patient sits there and has no answer. Maybe if you're lucky, you get the, well, I've read so-and-so's blog, or I've read online, but no formal training, no real plan, just I really want a natural birth and it's going to happen because that's what I want. Doctors have a hard time with that, understandably, because if someone is not educated in the process of how to stay low risk, how to eat well, how to exercise, what normal labor and delivery looks like, that leaves a lot of it up to the doctor. And the doctor is going to choose during labor and delivery to make the labor and delivery as easy for them as possible, which may not be the natural method. Understandable. You can't fault the doctor for making that decision on behalf of their patient if their patient hasn't taken the time to be educated. The second thing is liability. OBs have a medical license to practice medicine, and unfortunately, they get sued very frequently when births don't either go as planned or when the child that is born has a perceived disability or deformity. It's often the OB's license that's on the line. And so they have a vested interest in keeping you as safe and tightly monitored as possible. And with that monitoring comes what I call over monitoring. So often when a woman is in labor, she's strapped to an external monitor that's measuring the strength of her contractions, potentially, definitely looking at the fetal heart rate, and they're looking for something to go wrong. When they hook you up to that, they are looking for anything that is not perfectly normal. And certain fluctuations in the heart rate of a baby during labor are normal, and they have found through studies that over monitoring patients actually leads to more interventions. So because of the liability and wanting to keep close track of their patients, patients are often over monitored, and that leads to unnecessary interventions because something is picked up. It's really easy to find something wrong if you're looking for it and monitoring every single thing that's happening. And the third thing as to why a doctor may not support natural birth is time. A hospital is a business. They're looking for patients to come in and patients to come out because each patient represents a different pot of money. And once you're in the hospital, they have a vested interest in delivering you. And that may not be on the time clock that you and your baby need to naturally give birth. If a woman is laboring and she has no complications and the baby is tolerating things fine, it could be a several day process, and that's still considered normal. But in a hospital, there's a time pressure applied. And in some cases, that's fairly artificial, but they are operating sort of as a business. And, doctors are on call for a certain amount of time. They do have some pressure as far as time goes, and that may not support your wishes for a natural birth simply because they're trying to get things moving. So the biggest thing to keep in mind when thinking about why a doctor may not support your desires for a natural birth, if you look at this list, there's really only one of the three that you can control. The lack of patient education. Being educated is the thing you can control of all those things. You can't change the fact that they have liability. You can't change the fact that the hospital may have time constraints. You certainly could make your wishes known that you wish not to be hooked to a monitor all the time. But education is your key, really, to showing your doctor that you do know what you're talking about, that you can have an educated discussion about what your goals are, and that they should be supportive because you know what you're talking about. So I'm going to give you an example of a natural birth and how it might unfold and what it looks like. So I'm going to share with you my birth story so you can see where the important factors are for what we just talked about come into play. This is a picture of me the day I went into labor at 39 weeks and 4 days, and I will give you specifics about how that unfolded shortly. But before I went into labor, I educated myself. I was able to stay low risk because I ate well and paid attention to what I ate. I exercised almost every day. I had a personal trainer until I was 38 weeks pregnant. I did not have any complications during my pregnancy. I tested negative for strep B. I did not have gestational diabetes. I really had a fairly easy pregnancy, no significant things. And a lot of it I attribute to the fact that I was healthy before I got pregnant. And then once I got pregnant, I used it as an opportunity to be as healthy as I possibly could be. So I stayed low risk. I got educated, and by that I mean I took a 12-week long childbirth class. I took the Bradley method. There are certainly other natural childbirth methods out there, but I learned in that class everything from what I shouldn't be eating, exercises to help with baby's position and my pelvic alignment, to what normal labor and delivery is, what it looks like, how to spot certain stages of labor, what I should be advocating for myself for, when to trust my medical provider and when to ask for more time to make decisions. Anything you could possibly need to know for having a baby, I learned in that class. In addition to all of the Googling I was doing and blog reading I was doing and all the things that I was doing just as a normal first-time mom, using the internet to both educate myself and freak myself out. And then I also got a doula. So my doula was a friend of mine, but certainly I've worked with lots of women who work with doulas who they've never met before until they start to work with them. And I would highly recommend considering a doula. Our doula was an amazing presence and really helped me stay focused, and more than that, helped support my husband through supporting me. It's very hard to see someone you love uncomfortable for hours and hours, and she really helped guide him through, this is okay, this is where we are in the process. Since he had taken the class with me as well, he knew generally what to expect, but she sort of was his guide along the map that he already had, and that was extraordinarily beneficial. So that's how I managed to stay focused on a natural birth while pregnant. So now we come to this picture. I'm 39 weeks and 4 days. I work a full day as a physical therapist on my feet. I go and do errands, and I go into labor at 10 o'clock at night. And I labor at home for about 8 hours. And in the course of that time, my contractions went from about 1 every 10 minutes to about 1 every 2 to 3 minutes. And when we got to 1 every 2 to 3 minutes, I just decided that sitting in the car to the hospital was going to be too uncomfortable. So we should probably go. So we went to the hospital. They checked me in. They checked... They did a vaginal check, and I was 4 centimeters dilated. I was 70% effaced. My bag of water hadn't broken yet, but I was leaking fluid, and that met their admission criteria for keeping me in the hospital. Had that bag not been leaking, they possibly could have given me the chance to go home, but they were fairly convinced I was in the early side of active labor, and I progressed really well. I walked in the hallway, I used the tub, I used the birth ball, I squatted, I did hands and knees, I did just about everything you could think of. And by 10 or 11 in the morning, I was 6 centimeters, doing great. The doctor was convinced we were going to have a baby in a couple of hours. I, at this point, had had some routine blood work done, but that was the only thing that had been done. I didn't have an IV put in. I didn't have any monitors on me all the time. They listened to one contraction about every 30 to 40 minutes. But for the most part, what happened could have happened at home. It was very low intervention. And when they came to check me again, mid to late afternoon, I was still 6 centimeters. I stayed there for 6 or 7 hours at 6 centimeters. And as demoralizing as that was, given how uncomfortable I was, I knew from my childbirth classes and from my research that that kind of plateau is normal. There's a lot of people that experience that, and there's a lot of important things going on that aren't dilation. But if I hadn't educated myself, that would have been a golden opportunity to ask for some intervention, because feeling like you're not progressing can really take a toll on your ability to focus. So even that itty bitty piece of information really helped me stay in this game mentally. So after a couple more hours, they offered to break my bag of water. I had a lot of reasons why I didn't want to do that. But the doctor was wonderful and let us talk about what we might do. And with my doula and my husband, we decided that I was far enough along that I should probably try it, just because I was starting to fatigue from being up for so many hours. So they broke my water, and a couple hours later, I had a baby. I had a water birth, and it was amazing, and it was empowering. I did something I really never thought I could do. So these pictures are of me laboring in the tub, and then this is the birth of my baby. After about 25 hours of labor, my son was born. He weighed 6 pounds, 6 ounces. He was 19 and a half inches long. He was perfectly healthy. He didn't have any complications. We stayed in the hospital just over a day, mostly because the pediatricians like to keep the babies that long. We had no problems at all. He was as healthy as could be. And really, the key for making this beautiful, beautiful natural birth happen was staying low risk, being able to communicate with my provider in an educated way. And this is a picture of me and my family. I hope that this has helped give you empowering ideas about how to approach birth. It's not to scare you, but to empower you to know that you really do have a choice, and there really are things you can do in helping to have the birth of your dreams. I thank you for listening to this. I hope that it has helped you in some way. I love your feedback, and I'd also really love to know what else you would like to learn about. I hope to do some more presentations, and I'd like them to be tailored to your needs. So I appreciate your time, and come visit me at anaturalbirth.org and have a wonderful day. Thank you.